Maryland Governor Larry Hogan says it's vital the FDA approves all the coronavirus vaccines used in the U.S. The Republican is also pressing the Biden administration to immediately offer booster shots to seniors and other vulnerable people. Hogan, a cancer survivor, says he has already received a third vaccine shot. He joins us now from Annapolis, Maryland. Governor, good morning. Thanks for being with us.
Good morning.
With FDA approval of Pfizer, the president is urging local leaders, state leaders, to impose stricter vaccination requirements. What's the plan for your state?
Well, the great news in our state is that we're one of the most vaccinated states in the country, and we've already vaccinated more than 80% of the adult population, nearly 95% of our vulnerable population, 65 and over, because we took a lot of steps early on. But this is a big step. For the approval of Pfizer. It really has been the #1 issue for people that are being reluctant because it didn't have the approval. And now that takes that argument away. And we're looking forward to trying to finish up those last, less than 20% that we have remaining. We also have been pushing to make sure that we can reach those younger kids as we head back to school. We don't want to skip any steps, but it's critical that they get to work. And approving one vaccine is great, but be great to see if they can get final approval on the other two as well.
Yeah, as we mentioned, you've already received a booster shot, a third shot, and the FDA could authorize them for all adults in the fall. How are you going to ensure that the people who need them, the third shot, will get it?
Well, it's critically important that they do. And right now, they already authorized it for immune-compromised folks. Yes, you mentioned I had a cancer of the immune system, so my oncologist and our doctors recommended it. But we have found, we're doing antibody studies in all of our nursing homes and finding that we're seeing a little bit of loss of efficacy after 5 to 6 months. So some of our vulnerable folks, I know that they're working on this at the federal level, but we think they need to speed that process up. We can't wait till later in the fall. We can't wait 8 months. And so we have a call with the White House later this morning, and then I'll be meeting with a number of other governors, with Jeff Zients, the White House coronavirus coordinator, tomorrow. And we're hoping that we can make some progress both on the other approvals, on the boosters, and on the approval for younger kids.
Well, Governor Hogan, first, congratulations to you and your state with those numbers. Those are great. I see your earpiece is giving you a little bit of a problem. I know they can be extremely
annoying.
Sorry,
I'm not sure what the problem is, but I'll just stand here with my finger in my ear and talk to you.
No, you were rolling with it, and we appreciate that. Over the weekend, former President Trump, was booed by some of his supporters when he recommended that they get the vaccine. I'm curious if that surprised you when you saw that. And why do you think there is still so much skepticism about this vaccine that people are willing to ignore the science? First, did it surprise you he was booed?
It didn't really surprise me because, we've seen a lot of this kind of anger and frustration. There's a lot of misinformation out there.
But these were his own supporters.
I thought,
but these were his own supporters, yeah.
Well, there's been a lot of miscommunication for 18 months now, and for at least 8 months with respect to the vaccine. And the disinformation campaign is very prevalent on social media. A lot of people believe very strongly in things that just aren't true. And so it was good that the president said that he got the vaccine, but he didn't really push the message as strongly as I would have liked to have seen. And it really didn't surprise me that some of the people reacted that way.
Hey, Governor Hogan, I'm hoping to switch to Afghanistan here because as we're watching the scenes in Kabul, we know there are tens of thousands of Afghan refugees. They're going to be exiting that country, many of them coming to the United States. You have said you are ready and willing in the state of Maryland to accept those refugees. What are you hearing from the Biden administration in terms of when they could arrive and what kind of screening is involved?
Well, we've had some arrive over the past couple of weeks, a fairly limited number as they were starting to do some of the evacuations. Look, these are our allies that work side by side with us in some cases for 20 years. And we made a commitment to them. We've got to get all of our Americans out of there and our allies as well. I know that they're working hard on it. There's been a lack of communication, frankly. I know that 1,300 of them, I think, landed at Dulles Airport just over the line from us yesterday. They're being processed, and then we'll get information about when they get relocated to various states. I think I was the first governor in the country to say we got to stand by our allies. We're willing to take more. We currently have more of these SIV, special immigrant visas. That we're the fourth most in the country. And our number one segment of that is folks from Afghanistan. We want to continue to try to help them relocate because we owe it to them. We made a commitment. We can't let them down. I mean, what does it say? How does that? What kind of message does it send to our other allies around the world if we don't? If our word is no good?
Governor, you called the withdrawal an unmitigated disaster. What should we have done differently?
Well, I think just about everything. I think it was a mistake from the decision making, from the intelligence, from the execution, and from the communication standpoint. The White House seems to be trying to grapple with it, but it's been really done about the opposite of any way you probably should do it. First of all, we shouldn't have given up Bagram Air Force Base. We shouldn't have telegraphed exactly what we were doing to the Taliban. We shouldn't have made an agreement with them that allowed for a lot of this to happen. And we should have made sure we get our people out of there before we pull all of our troops. It's really pretty basic. I'm not a military strategy expert, but it seems like that's what some of the advice was from the military leaders, and I think we just bungled it from the start.
All right.
Can we go back to do we have time? Can we go back to COVID for just a second? Because you're one of the governors who appears to have a handle on this. Let's go down to Florida, where they're fighting against mask mandates. There's still a lot of talk about disinformation there. What do you say to your fellow governors, some in your own party, who are against the mask mandates?
Well, I mean, not only are they against it, but they're mandating against it.
Yeah.
So, if they're Republican governors who are saying they're all about freedom, and yet they're taking away the freedom of local school systems and, in some cases, businesses to make those decisions for themselves. We've tried to find the right balance. We've been encouraging mask usage. We left it up to the duly elected school boards in our state. That's who has the power to make those decisions. About 2/3 of our school systems voted to wear masks. Others decided not to. But to mandate that they have to or mandate that they cannot just doesn't make sense to me. I think it's a basic conservative Republican principle to let local decision makers make decisions.
Yeah, that is true. Governor Hogan, thank you very much for joining us. We appreciate it.